bit about your area of work, and specifically childhood dementia, and a little bit about that and your role?
Mm-hmm. So Childhood Dementia Initiative is a new organisation that we've launched just in the last few months, or we've registered in the last few months. We're going through the launch at the moment. This week is actually our launch week, our official launch week. And I started this organisation after working in this space for the last 7 years. So this is actually the second organisation that I've started. So 1 in 2,800 babies are born with a condition that could lead to childhood dementia. Individually, the conditions that do lead to childhood dementia are all very rare. Some of them are ultra rare, with only 1 or 2 known patients sometimes in the world. But when you group them all together, and it makes sense to group these disorders together because they have a very similar presentation and a very similar disease course and a lot of common disease mechanisms, things that are happening within the disorder, disorders that are happening across many of them. So the 1 in 2,800, actually, when you think about that in global terms, means 50,000 babies are born every year with a condition that would lead to childhood dementia. Based on the average life expectancy that was calculated in the burden study, we estimate there to be about 700,000 children or young people living with childhood dementia at the moment. And the death rate is one of the things that was quite horrifying. It's more than 90 children every year, or children or young people every year, die as a direct result of childhood dementia related causes. And that's a similar death rate to childhood cancer. So it's quite alarming when you look at those statistics that so little is being done in terms of finding solutions and therapies for these conditions. The incidence is equivalent to cystic fibrosis and the prevalence is equivalent to motor neurone disease. So we see childhood dementia as sitting in a huge global blind spot when it comes to the health systems of not just Australia but the world. And one of the objectives of the Childhood Dementia Initiative is to really advocate for systemic change so that we can actually develop therapies for these conditions. Of this, we identified 70 different disorders that lead to childhood dementia, and of the 70, less than 5% actually have an effective treatment. So that's just not acceptable. Yeah.
What do you think are the sort of biggest obstacles, I guess, in terms of getting the support, care and information and treatment for people in terms of your organisation?
Yeah, I think the biggest challenge that people with childhood dementia have is that there is so little awareness of this as a group of disorders, and historically all of the health systems have looked at the underlying cause of the childhood dementia. So, for example, my children have Sanfilippo syndrome. So if you look at any of their touch points with the health system, it is with a Sanfilippo sign on their head. And because it's so rare, and because so few people ever come across it in their professional lives, health experts or anybody that, allied health people or anybody that's dealing with these children, they don't really know how to manage them. And it's really difficult to build expertise around a really narrow diagnosis. But actually, when you look at the way that my children's condition presents, it's very similar to a lot of other children with childhood dementia. And so we think by grouping these disorders together, it will help the entire community, including those that are providing services and support to these children, have a far greater understanding of the challenges that families face when they have a child with a diagnosis of this condition.
So how would they group them together? Is that looking at the research around all these different types of disease?
Yeah, it's actually no different at all to the way that adult dementia is treated. So if you have a look on Dementia Australia's website, I think there's a line somewhere there that says we've identified 100 different causes for dementia or 100 different types of dementia. It's exactly the same thing. But we as a community have moved away from talking about Alzheimer's or one of the specific types of dementia, and we understand dementia as a concept. So it's exactly the same thing. Another 2 examples actually, childhood cancer same thing. Often you hear people talk about childhood cancer. You don't necessarily hear them talk about, osteosarcomas, for example, or cerebral palsy. The causes of cerebral palsy are multiple, and they're grouped together. And the Cerebral Palsy Alliance have made tremendous progress with research and support services as a result of pulling these conditions together under an umbrella term. So we're doing exactly the same thing. We're not doing anything new. It's been proven to be an approach that allows us to develop scale and really bring focus on something that is, at the moment, has a huge level of unmet need.
So what does that involve, actually getting those groups together? Is that...
We're developing the strategy at the moment in terms of the tactics that we're going to apply. We will be physically bringing researchers together, but I think at this stage it's about challenging the researchers to think differently about the disorders that they're working on, challenging the researchers to think about, okay, well, I understand this very specific disorder. How could the work that I'm undertaking on that particular thing potentially be expanded to other disorders as well? There are a whole range of different things and different ways that the researchers could be approaching their research if they change the mindset on how they're thinking about doing this. And we think it's going to provide great opportunity for the researchers too, because if we can generate much more funding to be directed into this space, it means that they can continue their absolutely vital work.
I mean, it's a new organisation. I guess thinking about that, say it's 5 years down the track, and looking back at what you've achieved, what do you hope will stand out for you in say 5 years?
In 5 years, I hope that society at large, understand that childhood dementia is a problem for our community, and understand and accept the challenges that families with children with these conditions have. In 5 years, I also hope that we have collaborative networks of researchers working together to solve the childhood dementia problem, not looking at only looking at the individual treatments underneath. In 5 years, I hope that we've got platform technologies in place that mean that the really expensive, emerging and pioneering therapies such as gene therapy have infrastructure in place so that the individual conditions don't have to build all of that infrastructure every time. So there's cost savings and economies of scale. They can build a single vector to deliver a gene and then modify that for the different genes that are affected. So there are a whole range of different infrastructural things that we can implement. I hope that we have biobanks in place where we're collecting tissue samples across the board of all of the childhood dementia initiatives, and we have shared data sets so we can see what are these conditions, what are the impact of them, where are the people who have them, and be able to track and monitor improvements in the course of the disease. And ultimately, I mean, what we want is for 100% of the 70 disorders that cause childhood dementia today to have a therapy. For so many years, families have been told, we know exactly what's wrong with your child, but there's nothing we can do to fix it.
Are there particular qualities that you need to have to run a successful charity like this one, and also the one, because you're running both, is that correct?
I think the qualities that are required are the qualities needed to run any successful business. Resilience, we get a lot of knockbacks, you have to have very thick skin, and good business acumen. Being able to identify a clear strategy and execute that strategy, I think, is absolutely critical. And the other thing which has helped us a long way on our path, with Sanfilippo, has been finding other organisations that we can collaborate with, and whether that is actually sharing, resources and projects, or doing things as partners, or whether it's just sharing ideas and supporting each other. That's been an incredibly important step for us, and we've got some great relationships with other rare disease organisations who we collaborate with on an ongoing basis.
What do you think has been the most difficult thing you've had to sort of overcome in this journey?
I think, there's been so many difficult things we've had to overcome. I think for me, it was joining a world that I had no knowledge of prior. So running the charity is one thing. I felt okay about doing that, although I didn't really know what I was getting into at the beginning. But I had come into a world of science and biology, and I had no background in science or medical or anything like that. So for me, it was like learning a whole new language. But actually, I think I could use that to my advantage as well, because often I'm the only person in the room who isn't a doctor or a professor. And so I can be the one that asks the really stupid questions. And I'll ask the same question, over and over.
Right, to actually convince people of the benefits of looking at that area.
We've had significant cut through in really telling stories and humanising those children to people, so that and it's a difficult thing to do. I've put my children into the spotlight a lot of times, and it's a really difficult thing to do. But I knew that I had to do that, because otherwise people don't understand what you're going through unless you can really share the experience of what it's like and why this is so important. It's just an abstract concept to people. And you can show them as many, researchers in labs in white coats as you like, but until they actually have empathy for what you're going through, you're not going to get a connection. So I think that's a really important lesson. But I think it is also one that you need to, an approach you need to take on with careful consideration, because it is a difficult thing to do personally.
So it's almost like that comes under childhood dementia, that the other organisation, the Sanfilippo.
Yeah, look, there are a number of organisations already in place. So Batten's BDSRA, Batten Disease Support Research Association, the Neiman Pick have an association in Australia. TASACs also do in the rare finds. There's a whole range of them. And we see those services provided by those organisations as vital and as ongoing. We're not replacing those at all. We think that it's important. There are always going to be things that are specific for individual disorders that need to be addressed at that level. But what we want to do is collaborate with the individual organisations. So Sanfilippo will continue and fund things that are specific to Sanfilippo. But if we have a project that potentially could include Sanfilippo, then they may come and co-fund with us on that. And overall, we want to be advocating for increased funding to come to this part of this sort of segment of the healthcare sector. So if we can get funding allocated for childhood dementia disorders, then the underlying patient groups potentially can access that. So I see the relationship with the individual patient groups as very complementary and symbiotic.
Okay, that sounds really good.
Yeah.
Well, just finally, what do you think are the most important things for people in the community to know about your organisation?
I think the most important thing that we want the mainstream community to know is that childhood dementia is a problem in our society, and that we're working hard to find solutions for that problem, and that we think there is a lot that can be done. So we would love support from the mainstream community around the work that we're doing.